Ladies and gentlemen, please take your seats. We're about to start afternoon programming. Ladies and gentlemen, please take your seats as quickly as possible. Thank you.
We're great. How are the workshops? Great. Okay, good. Applause for the workshop. My name is Michael Igo. I'm a senior reporter at Devex, which means that I get to work alongside fantastic colleagues like Catherine Cheney and Raj, who you've heard from already today. It's really my honor to be here and to get to learn about all of the exciting work that all of you are doing. This next session, I think, is going to be really exciting. We get to hear from 4 entrepreneurs who are really at the forefront of using technology to expand access to healthcare and reduce the burden of diseases that should be preventable. These are people with enormous talent, great ideas, and a commitment to bringing those ideas to more people to improve more lives. But we're going to talk about what happens after you get the idea. Where do you go from there? What are the opportunities and barriers to implementing innovative approaches at a scale that can truly unleash their potential? So I'm going to bring these entrepreneurs out, and we'll get to hear from them directly. First, Dr. Aparna Hegde, who's the founder and managing trustee of Arman. Dr. Barry Finette is the co-founder and CEO of ThinkMD and a professor of pediatrics at the University of Vermont College of Medicine. Barry. Dr. Rajesh Dash is the co-founder of Health Pals, an associate professor and preventive cardiologist at Stanford Medical School. And Silvana Sinha is the managing director and CEO of Prava Health. Thank you all for being here.
Yes.
Yes. So just to begin, to get us all sort of on the same page, to understand who we're hearing from and who we're talking to, I thought it would be good if we could just sort of go down the line and get a 30-second, and I'm going to hold, the clock is going to hold you to that, a 30-second description of what you're working on. What's the idea? What are you trying to put out there into the world? And let's just go one by one.
Yes, so Arman leverages technology to create scalable solutions which are cost-effective to both increase access to healthcare and information to women during pregnancy and infancy, so they demand care. And on the other hand, we use mHealth technology to create solutions where we increase access to healthcare delivery by improving training of healthcare workers through the country. And our programs are in 16 states in India. We reached across to 16 million women and children through our mHealth programs, the largest mHealth programs in the world, Kilkari and Mobile Mitra. And on the other hand, our mobile academy programs is actually training right now 150,000 health workers and will spread through the country in the next 4 years.
Perfect. Thank you. Barry, go ahead.
Yeah, so ThinkMD is a company it's a startup company coming out of Burlington, Vermont. The goal of it is to look at developing digital mobile health technology that transforms how a physician thinks and how a physician does a clinical evaluation and place it on a very simple to use digital platform that allows anybody to do a clinical risk assessment, integrated clinical risk assessment. Our technology was released just under 2 years ago. It's currently in 10 countries in Africa, South Asia, and Southeast Asia.
Great. Raj.
So Health Pals is a precision population health AI platform that's a layer of clinical intelligence over an EHR system that maps patient data into codified guidelines and best practices and produces automated checklists of what to do for what patient and what time, and provides that information back to health systems, providers, and even patients. And we're looking to reduce the burden of NCDs globally, especially in the underserved communities.
Silvana.
I'm the founder of Prava Health, which is raising the bar for the delivery of healthcare in Bangladesh with its fastest growing consumer brand. So we're building a network of integrated family health centers featuring international standard doctors, diagnostics, and technology.
These are people who know how to talk about what they're working on, I think. That's pretty impressive. Raj, let's start with you. And I want to start with you because you have a great origin story. You found your co-founder on a matchmaking website. I mean, we're talking about digital technology for healthcare. I mean, this is great. Right from the beginning, it's built in.
Yeah.
And that's been, a colleague described that to me as sort of Tinder for people who want to found companies. That's probably not exactly what your experience was like. But so there's where you began. I understand you actually have an exciting announcement to share with us today. Why don't you tell us what that announcement is, and then maybe you could sort of trace the path from where you started to where you are today.
Yeah, so thank you, Michael. So very exciting announcement for us today. Just 2 days ago, we signed an agreement with the government of Telangana in India to deploy our platform across 350 of their Basti Davarkana clinics, the slum clinics that are helping so many underprivileged people in those communities with our platform to help reduce NCD burden, gestational diabetes, and tuberculosis. And that is phase one of what will be a statewide rollout. And the magnitude of that deal is probably over $100 million over the next 5 years to deploy that program. So that's very exciting.
Congratulations.
Thanks.
So matchmaking site to deal with the government. How do we get there? What was the key moment that that pushed you
So
towards?
I'm a preventive cardiologist. I have no software coding background whatsoever. I thought Python was a snake, and it's not. And I needed a technical co-founder to build what I had envisioned as a preventive cardiologist at Stanford. I run a clinic that reduces heart disease in South Asians. I wanted to scale that platform. So foundersdating.com was the website, and I swiped right. You know, I think that we need sometimes technology to help us find matches, and actually this has worked out quite well. From founding the company, we went through this pretty rough road for the first couple years where we thought our solution was to show doctors at the point of care what they should do for a patient sitting in front of them. And they loved it, but they didn't have the budget or the vision to pay for that, and the business model wasn't there. And so we said, well, what about a health system? If we produced checklists for every individual patient and scaled that up to a population level for an entire health system, would that be useful? And in fact, it really is useful. And in the US, unfortunately, there's so many misaligned incentives in healthcare, it was actually hard to sort of find exactly where that first appetite might be. But internationally, single-payer health systems, state-funded health schemes like we're seeing in Telangana, they really are incentivized to reduce the cost of care and get better outcomes by focusing on prevention. Similar to how the vaccine programs have really made a dent in infectious disease mortality, they're dealing with a massive burden of non-communicable diseases, cardiovascular, metabolic disease in India and South Asia, but also in the Pacific Rim as well. And we think we can make a major impact by leveraging not only our technology, but de-risking it for governments with impact investment. And that's actually how this platform can be scaled, is with outside groups, private equity, foundations, even pension funds, putting up upfront capital to actually deploy these technologies for the health system at no cost, and really allowing our preventive solutions to take effect and reap the savings 3 to 5 years down the road.
Great, thank you, Raj. Aparna, I want to hear about your scaling journey, as it were. You're tackling an enormous challenge in maternal and infant health in India. You're also operating in a context where there are tons of pilot projects that sort of fail to reach scale. A lot of what Catherine was talking about this morning. What do you see separates initiatives that reach scale from those that just never get past that pilot phase? And how have you worked to position yourself to stand out from the pack?
Yeah. So the idea for Arman and the programs we do came while I was doing residency in India, and I saw very closely how lack of access to preventive care information and healthcare access led to loss of lives that are completely preventable, of mothers and children. And very early on realized that if you want to impact India's numbers, India has some of the largest maternal child mortality rates in the world, you have to design for scale for day one. If you create resource-intensive pilots, they are very, the impact is seen, but then when it comes to scale up, you just can't create a parallel network, right? Government of India has a very massive public health infrastructure through the country. So it had to be designed for scale from day one, and in such a manner that when you scale up, there's no dilution of impact. So you have discrete programs that are proven, but the unit of the program remains the same whether it's the first woman or the 20th million woman, right? So that's very clear from day one. Secondly, you can't create a parallel network. You have to leverage what already exists. So our programs leverage the existing government health workers and the community partners, NGOs. It is a very robust community NGO, network in the country, leverage that to create solutions. And also create a tech plus touch model. Technology, so when I saw very closely how lack of access to preventive care information led to loss of lives. Women would come to the antenatal clinic once, 200 patients waiting outside, waiting for 4 hours in the line to get just 1 minute with me, and they would never come back. And then they come back dying, and I have seen personally where I've seen a dying patient open the papers, and it's my handwriting, seen her in 3rd month, and she's never come back, and she's come back dying. And I realized, and suddenly mobile phone came to India, right? And suddenly realized that why not use mobile phone, because within 2 years, everybody had a mobile phone. Literally every family has a mobile phone. So why not use a mobile phone to send information across to women in the chosen time slot of language preference, time when targeted. Right? But realize that though technology is great, you can use a mobile phone, you have to couple that with touch model. So you have to have, so we enroll women in the hospitals where it's integrated in the system of the hospital. So the woman thinks the hospital doing it for her. Then we enroll women in the slums because women come to the hospitals too late. So we leverage and incentivize the health workers, existing ones, to enroll women. And we also have a call center. So there's a touch piece also. The program is introduced to her by a health worker, but it still remains resource light because the health worker is not then needed to go weekly or monthly. The technology takes over. But if she has any query, because we have a voice call service, we have 3 tries for every message, 2 voice calls every week, pregnancy and infancy, missed call system if she missed any message. But again, if she's got any query, there's a call center she can call her. Right? So it's very cost effective though, right? So, and now Kilkari, that's our program with Government of India, which took off after we did our flagship program, Mitra, very well, it's gone across 16 million women. So for us, cost per woman is 24 cents. Right? So applying these principles, we'll be able to scale across. And now we're going to add 4 more states every year till we go on to the rest of the country. Similarly with the health workers, right? There's an ASHA worker in every village. And the ASHA worker, who's a community health worker in every village, and she undergoes a 20-day training program when she kind of enters. But after that, there's no refresher training. So technology, mHealth, becomes a very good tool to be able to kind of, teach her, train her further. Like, so we have this mobile academy program, again with the Government of India in 13 states in the country, where she's got 11 chapters. She can call in, 4 sections to each chapters, a quiz at the end of each section, and a bookmarking system. She calls in when she has time, and she can log off and log back again next time when she has time. And it gives her a certificate. So there's a very good tool to train the ASHA workers, and refresh her. And when you have a new, say for example, vaccine coming to India, that can be a tool of letting her know. So technology allows you to do that and scale up. And that's why we followed these principles at the very inception, and hence we've scaled across. So both Kilkari and Mobile Academy happen to be the 2 largest such health programs in the world.
Great.
Because we follow these principles.
Great. So we've heard about partnerships with community health workers,
And
with government, with impact investors. Barry, you've partnered with the global health community, with aid organizations, as you've worked to bring ThinkMD to scale. Can you share a little bit of your experience working with that sort of particular community with its own ways of functioning, and what you've found to be kind of the opportunity in that, but also some of the barriers? I mean, this is the global health and development community. I don't think I would be going out on a limb and saying that it tends to operate sort of according to its own rules with a lot of procedures in place that take a long time. How does that work together with something that needs to move quickly, like innovation?
Thanks, Mario. So that's a trick question. So think about a story. I mean, our personal story is that, think about, I'm an academic pediatrician. My background's in emergency and critical care from northern Vermont, thinking that they have an idea how to transform and build a digital health platform, going into this global health community, where I work in an area where the venture capital or resources to build that technology is virtually zero. I don't come from Boston. I don't come from Silicon Valley. It's similar to startups coming from low and middle income countries. And trying to work their way into this environment is not without a number of challenges. The resistance to look at new technology, how it actually is may be of value, the recalcitrance of organizations to come into that world and take a look at technology, or the barriers associated with it. So, our idea was to be tenacious and do the best we could. So we developed this technology. Clearly, if you want to make something prove it's of value, then you try to test it and validate it. We spent 2.5 years with very limited resources, working in 5 different countries with 7 different aid agencies and Ministry of Health, validating our technology, putting it in the hands of frontline healthcare workers, demonstrating that with minimal training, that they can do clinical exams that associated with, correlate with clinicians' exams between 85 and over 95% with each evaluation, and that was published. And even after that, there is enormous recalcitrance to look at these things. So what you have to do is build partnerships. You have to do a lot of networking. You have to have a lot of discussions with people, and you have to do the best to find people who don't have a fear of failure within all these organizations. It's a huge barrier for us because the internal fear of failure of the organizations we deal with is a major barrier. So we look for those early adopters who are willing to look at us and to maybe provide us a way forward.
Did you find anyone here today without a fear of failure? You don't have to answer that question. But seriously, I mean, was there one partnership that did provide that opportunity that sort of the rest of the system wasn't quite latching onto?
Well, it's not necessarily an organization. It really comes to personal people to an extent. So, for example, we had some early relationships with early adopters in Save the Children and in UNICEF, the 2 largest pediatric and childhood international agencies in the world. We also have key relationships in small program in Zambia with a school-based program where they're training their school teachers to become health workers. Both those have proved enormously valuable. We've developed enormous impact data with that. We've demonstrated its ability to scale with quality, and scale with financial sustainability, and they're both of value. So you have to basically not be very picky on who you want to work with at the same time.
Great. Silvana, I want to turn to you. It's not as simple as just coming up with the idea and then unleashing it onto the world. There are a number of different decisions that you have to make along the way, and one of them is what type of enterprise you're building. Is it a for-profit enterprise or a non-profit enterprise? How did you go about making that decision, and how has that affected the way that you've been able to roll out this vision?
Thank you for that question. I actually was always very clear that I wanted to build Brava as a for-profit entity because I strongly feel that the only truly sustainable form of economic development is private sector development. And there's an important role for philanthropy and charity, but in order for an economy like Bangladesh to lift itself up, there have to be entrepreneurs and sustainable businesses that are built. That's how the United States came to where it is today. That's how most of the global economy has been built up. And it has presented challenges because I think that funders are more accustomed to thinking about countries like Bangladesh as the recipients of philanthropy and charitable funds. And I think it's been a wonderful part of Bangladesh's journey. You have foundations like Gates and Rockefeller and USAID and World Bank and ADB and others that have done incredible things to help Bangladesh come to this moment in its economic development where, on social development indicators, it's doing better than I think any other country in the region. Life expectancy is 74 years, which is more than parts of San Francisco. And so this is an incredible moment, but now that we're here, I think it's time for us to invest in building sustainable solutions. And so that's why I came to the table with this solution. And in particular, I wanted to serve the middle class, which I believe is a really underserved segment of the population, and that has disposable income and is willing to spend on quality health care. And they're traveling in the hundreds of thousands every year, often selling land to travel to India and other countries. And I think they deserve solutions in their own country.
Great. I'm curious if others of you have responses to that same question. Just thinking about sort of going from idea to sort of structured enterprise, what were some of the really critical decisions that you made in that process? Whether it was, whether to be a are you all for-profit?
No, we are non-profit.
Non-profit, okay. So maybe, could you respond a little bit to that and why you came down on the other side of the equation with your model?
For non-profit?
Yeah.
For me, I mean, I saw day in and day out underprivileged women and children losing their lives for something that should be a human right. I think health and education should be everybody's right. A world that cannot take care of its women and children really is not a world that I want to be living in. And having seen so many deaths over and over and again, I mean, I didn't want, I see that in my own practice as a urogynecologist. I have my practice as a I mean, I can't offer less care because somebody cannot afford the kind of care that she actually deserves, right? So, and what I realized that when you create scalable solutions, I mean, the whole point is that when you design for scale, it's really cost effective because if it's going to cost 24 cents to do a Kilkari program, I'm sending her information for 2 years of her life, it's cost effective, right? Because government spends far more money on the women's healthcare with less results. So if you can really create a very, a program that works, has impact, has proven impact, and is scaled up using technology, you can keep costs low. And in that sense, it's sustainable, right? I mean, yes, and also a world where you and I can go online and get any information we get for free, but I will give the same information to a woman for a fee. Didn't work well with me. I thought that both access to healthcare information, all women should have access to healthcare information about how they take care of themselves and the children, and the access and training of health workers. These are volunteer health workers. If they should have access to training that can actually,
Right.
That's why we have nonprofit.
So part of it sounds like, is clearly understanding who your market is, or who your clients are in this case. Raj, when you think about sort of this picture, first of all, who is your core client for the technology that you're putting out there?
So it's really the payer. I mean, basically, if you think about it, we're providing insights for health providers and health networks, certainly, but ultimately the person who is, obviously the patients are benefiting, the providers are benefiting, and that's our core mission, but the person we have to actually sell to in terms of convincing that this is a worthwhile endeavor are the people who are footing the bill for the healthcare. And that's really where the challenge comes in, is you need to make that case very clear to them, and it takes a lot of detailed line item budgets for what they spend on their healthcare for their population. But ultimately, they're at risk, and any at-risk health system would benefit, we think, from this type of a solution or other solutions like it that can help their population live healthier lives. The interface with our platform, though, is with the health system, and so we have a lot of moving parts. It's not an easy process, and I guess hard things are hard for a reason sometimes, because these are tough challenges. But I think you need to make this era of technology available to those populations, and this is one pathway to doing it.
Barry, I want to come back to the comment that you made earlier. I wonder if is there one thing that you think the global health community could do to become friendlier to startup technology, to become better at adopting things that you can prove that they work, but to work those into the system?
Oh my goodness, I think if I had that answer, then a lot of my problems would be already addressed. I don't have an answer for that. I mean, it is a very complex, multifaceted, challenge in a sense. I think that maybe I'll come back to this fear of failure coming back. It's an enormous problem that I think fails. I mean, I started as a research scientist and a physician. If you want to fail at your career, constantly become a research scientist and a physician. Okay, every one of your patients are eventually going to die, unfortunately, but you really want to prevent that from happening, obviously. And in research, you can't be successful in research unless you constantly fail to find out answers to things. And I would just have to say that I think there are enormous potential in people all through the world, and technology in the world, and people with great ideas. You need to take risk on them and to look at that. And this is not something negative to, again, let's say the Boston area, the Silicon Valley area, which there's a lot of growth and amazing technology. There's other places in the world besides that where new ideas come from. And I think there's an enormous missed opportunity there.
I think if I could just piggyback on that a little bit, and it relates to the work that you do as well, Raj. There's huge opportunities in our markets because we don't have HIPAA. And we don't have a lot of the regulations around privacy. We still need to make sure that we're taking those concerns into account when we're serving our populations. But it creates enormous freedom to create solutions that actually serve providers and patients instead of the ones that exist in developed markets, which are often really set up for billing purposes.
You looked like you wanted to jump in, Aparna. Maybe
I
you were just
completely
nodding
agree.
vigorously. Okay.
No, because the solutions are in the global south. We work intimately with the field. The populations are there. The problems are there, and the solutions need to come from there,
Right.
and not top down.
So
Yeah. Somebody brought up earlier today, I think they were talking about looking at emerging markets for developing innovation. I think that's an enormously powerful thing. I mean, to develop certain technologies and innovations, I mean, Raj has been enormously successful in implementing, let's say, US-based type of approach into an emerging market. I think that's novel in a sense. The US, if you use US healthcare-based system innovation, it's there to decrease cost.
Yeah.
Well, hopefully maintaining quality, but its main goal is to decrease cost in a very broken healthcare system. And the emerging technology is really where most of the mobile health and digital technology is being developed and tested. So it's a great opportunity to look at that and to take advantage of that.
great.
And I would also just add that the solutions that I think we're trying to provide to these populations, even just basic medical services, is something that everyone should have access to. I agree. This is not the highest levels of technology in terms of the actual treatments, right?
Yeah.
This is low-hanging fruit. This
Yeah,
is
absolutely.
starting someone on an aspirin or metformin or getting them the proper blood pressure checks and the medications. This is stuff we know it works. It's just a matter of how do you disseminate that using technology to the people who don't have access. And I think that's a common theme I see in terms of
Great.
on the stage.
I want to very quickly get a quick question from the audience. And I know that we have Rebecca Disler here, who's the Director of Global Health Initiatives at Element, and is someone who spends a lot of time thinking about scaling innovation in global health. So Rebecca, please.
Thank you. Thanks, Michael. And thank you to the panelists for this conversation. Some quick context for this very specific question. Element develops an AI-based solution for biometric identification. It uses the existing cameras on mobile devices, so no specialized hardware, works offline without connectivity. And over the last few years, we've been working with health research institutions across Cambodia, Bangladesh, and Mozambique to extend the solution to infants and children to create a digital identity to link them to digital vaccines and health services. Something we heard along our journey from organizations and institutions was this technology is exciting, it's solving a challenge that we haven't been able to solve yet, but come to us when it's ready. Come to us when you have generated evidence that this will impact health outcomes. And so I want to take the panelists back to kind of the start of your own scaling journeys, because generating evidence is something that's really important in that scaling journey, but it's an expensive endeavor. It can be complicated, particularly for other technology companies in the room that may not come from the public health background. My sort of specific question is, how do you incorporate evidence-generating activities into a business plan? And really, I think having both the private sector and the nonprofit models on stage, how does that change if you're talking to an investor versus a donor? Thank you.
Great question.
Yeah.
Feel free. Yeah.
So, I mean, it's important that you only scale up a proved solution. You don't have that much money to waste on a solution that has not been proved. So we start off as research studies. Every program of Arman has been proved. We did an RCT. Amit Rankel had a RCT supported by DFID UK, which proved impact, and then we scaled it up. Extremely important. And I think if you kind of put it across donors correctly, about the fact, and I think donors also want to see impact data, right? They want to know that the money they spent has led to value. And that's only possible when you kind of generate evidence and only scale up after that, right? So imagine scaling up a solution that doesn't have impact. I mean, that would be horrendous. Yeah.
I would echo that. I think, I'm sure you would, if you can publish the results
Yes.
that you're doing, work with medical societies. We're very fortunate to develop an early partnership with the American College of Cardiology, and through that partnership, we've analyzed 170 million unique adult lives in the US, so 1 out of every 2 adults. We probably have EHR de-identified analysis records of those patients over the last 10 years. And so we were able to show some high-level population results to some of these government health systems to say, yes, our platform is robust enough to handle Indonesia, which has 200+ million people, or Malaysia, or or India. And so these are things that we had to prove and create evidence and actually publish that evidence, which we're doing actively. So.
Silvana, your whole enterprise is building trust. So
Right. Yeah,
evidence
it's
is
a
big
really,
piece.
really important question. So thank you for it. I think one of the things we really struggle with in markets like the United States, when value-based care models have started developing, models like Iora Health and Oak Street Health, for example, that have been really successful in the United States, they're able to prove the impact of their work because we have a third-party payer system in this country, and that third-party payer has historical data on patient populations. In Bangladesh, 1% of Bangladeshis has insurance, and it's all inpatient care. So there's no payer who has data. So we've introduced an innovative financing model whereby you pay a flat rate for unlimited access to services. For a price point starting at $30 a year, going all the way to $350 a year, you can come see a doctor every single day. Now, how do we measure that having that ongoing access to outpatient care is actually impactful? It's very difficult because there is no baseline data that exists. And it's hard for me to go to investors and say, please fund this research for me. So we're actually setting up a nonprofit to help to deepen the research that we were able to do. What we have been able to do in our own piecemeal way is we have people who sign up for the membership plans, and we have people who've come in off the street to access a la carte services. And we do have initial data within those populations based on self-reporting that people who access the membership plans are less likely to be hospitalized. But it's not at the robust level that you might hope it be. So it is a real challenge for us.
Very final words.
Well, I mean, it is an enormously important question. But think about it, if you're a young startup and you basically are trying to survive day to day, week to week, how do you actually make a commitment to do that type of evidence-based research? I think one is you just have to do it. You have to look at your investors, and they're not going to want to fund that. They're just not going to want to fund that. And you have to say that's part of the obligation that we have to do, looking at the impact data. But there's one unsung thing that I think may not be obvious. Getting the correct data to do your impact is not available in many cases. A very simple example is we want to look at our financial impact and implementation of our technology. And we look at the current cost of a program that's looking to scale what we're doing, and we're trying to get baseline financial costs, let's say, for teaching and training and the implementation of this, let's say the frontline healthcare workers for delivering this type of service. Some places will provide it, some people have it, and some people don't. How do you actually get that impact data? You know, getting data and getting the appropriate one is one of the things that we work on quite extensively, but it has to be a commitment. And I think on the other end, I think the donor should probably have a certain level of expectation for the quality of studies that you do. And that also is really important. I can, you know, unfortunately, as a research scientist reading this stuff for 35 years, there's a wide variety of quality out there, and it's really important to look at that appropriately.
Great. Unfortunately, that's all the time we have, but please join me in thanking our panelists. I hope you're both inspired and got a little bit of a reality check here, but thank you all so much.
Thank you.
I'm going to turn the stage back over to Raj, who's going to share news about an exciting new initiative from Malaria No More, an initiative, by the way, that you can read about on Devex today. Thanks so much.
Nice job. Thank you so much, Michael and panel. That was inspirational. This is a solutions-oriented day, and it's cool to see people who have actually started startups in really tough environments and markets and are making them work and making them scale. And that's what we've got for you right now is another solution, another initiative, some real action that we want to bring to all of you in another announcement, as Michael said, that you'll be reading about on Devex shortly. So with apologies to all of the groups here who decided to give yourselves like 5-syllable names with no vowels, I love this next group, Malaria No More, because it's really clear what they do. So I'd like to invite in Martin Edlund, who's the CEO of Malaria No More, and Anya Ahern, who's the Managing Director of DataBlink LLC, and Lauren Wall, the Senior Program Officer at PATH, to come join me on stage. You can hear a little more about this announcement, which is clearly about malaria, at least in part. Go ahead and have a seat.
Thanks, Raj.
So, last week it was T-shirt weather in Antarctica. A little scary. Climate is shifting quickly. It's easy to feel like it's a totally hopeless situation. There's nothing we can do, and there's obviously a lot of health impacts from it. You've got a big announcement around weather data and mosquito-borne illnesses that connects to climate. So maybe we can just dive in, and Martin, tell us what is the announcement.
Sure. Well, thanks, Raj, and thanks so much for having us here. It's been a fantastic day so far, and I would say not only relevant to what we're talking about, there was actually a moment this morning when Naveen from Rockefeller was up here and started talking about a farmer and his weather app and a health work. I thought he was going to steal our thunder and actually announce something along the same lines. So as you mentioned, there's a lot of energy and a lot of concern about this intersection between climate and health. It's something that Dr. Tedros at the WHO has done a great job of positioning, climate as a health issue. Estimated 7 million lives are lost each year to, directly to climate-related causes. We're focused on a subset of that, mosquito-borne disease, which is incredibly climate sensitive, as we all know. Half the world is at risk of mosquito-borne diseases like malaria, dengue, chikungunya, Zika, and yellow fever. It's as predictable as the rains, that people experience these things.
And it is because, sorry to interrupt, but it is because of the rains in part that it is a very climate sensitive issue,
Absolutely.
right? And
Absolutely.
different elevations now are seeing mosquitoes that didn't see them before.
Yep.
Areas are getting more rainfall than they used to.
So new latitudes, new altitudes, you have an increasing frequency and severity of extreme weather events, which disrupts health systems, so lots of ways that this impacts. And as we started to look at this problem, we saw a lot of people out there thinking about the risks and thinking about how to mitigate these things. We saw an opportunity to turn this obstacle into an opportunity and to actually harness weather data to not just kind of mitigate risks, as we said, but actually to accelerate progress against mosquito-borne disease. And so we're excited today to be announcing, as you're reading behind us now, Forecasting Healthy Futures, which is a new initiative convened by Malaria No More, but with many great partners that's using weather data to combat mosquito-borne disease. And so what I want to do is talk really quickly about the partners, because it's a big theme of today is kind of strange bedfellows, unusual partnerships, and I think we have one here, and it's a real strength. And then very briefly, what we hope to do with this initiative. So first of all, we have fantastic health partners, some of the most innovative health partners in the space, in partners like PATH, like the Institute for Health Metrics and Evaluation, working with Malaria No More. But what really makes this special is that we have partners from other sectors. We have partners like the Crown Prince Court of Abu Dhabi. The Crown Prince Court has a long history of working in disease elimination, but they've also helped to convene this. It was at the Reaching the Last Mile Forum that many of these partners first sat around a table together and talked about these issues. We have exciting data and technology partners. The IBM-owned weather company is a collaborator in this effort. You may not know it, but the weather company does about 25 billion unique weather forecasts every day. So virtually anywhere that you're seeing weather on your iPhone, on your desktop, it's coming from the weather company. And so bringing that sophistication of data, that granularity of data to this issue. We have partners like Tableau, one of the best-in-class partners for data visualization. They're bringing financing to this. They're bringing their technology, licenses, training. They're making available what they call Tableau Zen Masters, like Anya here, who can provide technical assistance and really help not just those of us here talking about this, but our partners in countries to figure out how to use these technologies to make an impact. So what do we hope that this partnership can do? 5 things, very quickly. One, we want to use hyper-local weather data to equip program managers and frontline health workers to time and target their interventions to have maximum impact. We think we can use predictive analytics. We think we can identify where you're going to see the next outbreak in malaria or dengue or chikungunya and anticipate and address it. Secondly, it doesn't stop with frontline ASHAs and health workers. We ultimately want to communicate to the people that are at risk of these diseases, so that in the same way that my weather app tells me that in 12 minutes there are going to be rains, that I'm entering into an area where there's a dengue or a chikungunya outbreak, or I'm at a real risk, heightened risk of malaria, so make sure my family's sleeping under a bed net. Thirdly, we want to shape the policy conversation. We think the solutions at the intersection of climate and health are going to come through data-driven, technology-driven solutions. So how can this be an example? How can this shape the conversation for others who are thinking about this? Fourth, we want to think about scale from the beginning. We heard earlier today that there's a rampant case of pilotitis going on. Too many small-scale efforts that even if they work, don't have a path to scale. So we have collaborators like the US President's Malaria Initiative looking over our shoulder, helping us to design this from the start, so that if and when we demonstrate that weather data can be transformative, we're in a position to work with them to scale to 27 countries across sub-Saharan Africa and Southeast Asia. And lastly, and this is really kind of the call to action to those of you in the room and those who may be listening, we want to invite partners in. You're seeing a set of logos up there, this core group of partners. This isn't even the beta, this is the alpha, right? We are just getting started in this. And we wanted to put it out into the world at this early stage because we want to invite partners who have technologies, who have lessons, who are working in geographies where this would be relevant to collaborate with us.
There's a lot there I want to dig into, but just on this question of partnership, maybe I can bring you into it, Lauren, because you're running large-scale health initiatives, especially in the digital space. Why is it important that you have these partners when you're dealing with a digitally oriented health challenge like this versus maybe people here in the audience or watching this in the live stream who say, hey, I'm in a very significant technology company. I'm just going to do this myself. I'm going to contract out. I can find a solution on my own. Why is the partnership model so critical to something like this?
Yeah, great question. I'd love to see just a brief show of hands here who's had a successful project without partnerships. Exactly the answer I was looking for. Thank you all so much. These partnerships have been really effective. Path has been building these kinds of partnerships for about 40 years to really affect all aspects of creating this data use culture. We know it's not just enough to hand someone a dashboard that's been developed in Seattle or San Francisco. There are other elements that have to happen to make sure that the data is available through these novel partnerships, like incorporating weather data through amazing tech stacks that partners like Tableau can contribute. But they also need partnerships deeply with the Ministry of Health. As Dr. Florence was speaking about this morning, they can't be just drive-by meet and greets. But we know from our experience that there are deep partnerships with the ministry and that the ministry is one of our key partners in driving these use cases, identifying the main pain points that they're experiencing and really shaping these.
Maybe we can give the example of Odisha State in India and how they use this, because that is a good example, I think, of local government looking at weather data and saying, we're going to change the way we operate and having real impact.
Yeah, so what we're talking about here is not just theoretical. We're seeing some profound examples of timing and targeting based on weather to have impact. So Malaria No More is working in Odisha State in East India. A few years ago, Odisha was the highest burden malaria state in the entire country. It has 3 or 4% of the land mass and population, but it was 30 to 40% of the malaria burden nationally. And then Odisha came up with a brilliant hack. I don't know that they use that language, but here in San Francisco, we'll call it a hack. Traditionally what happened is you wait for the monsoons to come. The rains come, mosquito breeding sites everywhere, roads wash out, communities are isolated, everybody gets malaria. So they had the insight, what if instead of waiting for the rains, we went into the communities where the data tells us this is going to start, and we did population level screening and treatment. So using a 30-cent rapid diagnostic test to identify people who have the parasite, treat them on the spot, and essentially get rid of the parasite before the rains and the mosquitoes come. That simple intervention, combined with standard stuff like bed nets and ASHA workers with testing and treatment, but that intervention has led to more than an 80% reduction in malaria cases in what was formerly the highest burden state in India. It's now dropped to 4th or 5th on the list.
And I know in other examples around the world, Tableau software has been critical because you might have that data, but then you've got to be able to visualize it for the people who have to be able to make these decisions, including at the local level. And you run a data visualization company. We know the power of Tableau. We use it ourselves at Devex to demonstrate and visualize funding data.
Yeah.
But this is often for community health workers or health ministry officials. Where does it fit in to this partnership? Anya.
So having worked with the Tableau Foundation on several different projects, including for PATH, for Visualize No Malaria, we actually spent a lot of time going out to the field to talk to the health workers and the people that are running the facilities. And as Lauren had mentioned, we can come up with fabulous geospatial visualizations that we think are, spectacular and cutting edge in San Francisco. And when we show up to the field, they don't even have a smartphone, right? So really going and listening and having empathy for the day-to-day tasks that these health workers engage in, and asking what are useful tools that can help you get your job done more efficiently. And so looking at things like the weather data, and I've been fortunate enough to work with the weather company on other projects like Bridges to Prosperity, where we analyze weather data to inform operations and logistics. Looking at building models that incorporate not just the weather data and analytic capabilities, but things like topography and geospatial data to understand the likeliness of water to pool, and then mashing that up with the prediction of rain to really see where the mosquitoes are likely to develop and where those are relative to population, and then providing those health workers with those tools to understand where they need to go to be most effective. So it's been really successful for things like Visualize No Malaria, and so I'm excited to bring the weather in and really see what we can do.
Yeah, and especially in an era where weather is changing so quickly,
Yeah.
where you can't just say, well, let's look at what last year's season was and the year before that, and we can model based on that.
Yep,
We don't
forecast
really
them.
know what the models are going to be like in the future years. We need to be able to iterate and move very quickly.
Absolutely, and there are at a high level, three ways that changes in weather patterns really affect mosquito-borne disease. One is subtle changes in the timing and intensity of rainfall, humidity, temperature affects not only mosquito breeding, but actually affects the evolution of the parasite or virus that's being transmitted. So that has a big impact. Secondly, severe weather events like Cyclone Fani that hit Odisha last year absolutely disrupts health systems. And you see cholera, malaria kind of spike up in the wake of these things. But it also affects human mobility, right? When you have these severe weather events, it pushes people out of their home communities. And when that happens, they may bring viruses and parasites with them. And we talk about the mosquito as the vector for malaria, but mosquitoes live within a 1 kilometer by 1 kilometer box. It's people moving from place to place that bring these diseases to new communities. I saw an incredible statistic that it took 300 years for the first 3 mosquito-borne diseases to move from Africa to the Americas. In the last 16 years, we've had 3 novel mosquito-borne diseases move from one part of the world to another and affect hundreds of millions of people.
Yeah, and malaria is one of these ancient diseases that is really complicated and challenging to address anyway.
Right.
You add the climate dimension on top, it becomes even more complex, but we do have the new tools. And that's part of kind of the hopeful message we're hoping to take out of today is if we can actually apply those new tools and find the new models, maybe there's something we can really do with this. Now, what do you want to say to those who are here today who might be working in something tangential to this or somewhere connected, maybe different geographies than where all these organizations work now? How might they actually get engaged in a way that would support this initiative going forward?
So I'll start, and please jump in. We have a great core group, but there's a lot more that we need for this to realize this vision that we've talked about. For one thing, we need to work with mobile partners. We need to work with social partners. We had fantastic conversations with the Facebook team yesterday about, we're bringing a weather dimension to this. What if we could bring a social dimension to this? How would that transform the fight against mosquito-borne disease? We want to work with partners who are in other geographies where these are relevant challenges. And if you are listening to this and you have an idea for how weather data could transform how you're doing your campaigns, come and find us. Let us know. Let's figure that out. And we have absolutely no monopoly on good ideas. There may be other data sets that we're not thinking about that would really influence this. So if you have that knowledge, if you have those ideas, if you're working on those kind of projects, forecasting healthy futures, it's a big cloud. We can all work in it. So please come and join us.
Any other thoughts on this, Lauren?
Yeah, I think that the opportunity for tech partners is huge. Everything from different data sets to enabling data exchange, interoperability, but then there are still the human parts too. So we've already touched on the Ministry of Health partnerships, but other local champions that need to be built to be these users of data, building the types of local champions and data use champions that Anya was talking about to be able to act on this data. I think is another powerful part. So if you're working on organizational processes to enable data for action, or if you're working on individual behavior chains to promote data use, then there's a place for you in forecasting healthy futures.
Any final thoughts from you, Anya?
Yeah, so looking at the Tableau Foundation with the Visualize No Malaria project, it initially just started with Tableau and PATH. And as I mentioned, we found these health workers, well, they needed access to things on SMS. That was their form factor for a dashboard. And so we reached out to Twilio, and they suddenly donated the SMS service. And then as we started to scale, I was doing a talk at a Women in Data conference, and a woman that works for a high-speed in-memory database approached and said they wanted to help. And suddenly we had immense processing power that would enable us to be able to do these predictive models and really crunch the data needed. And then it just kept expanding where we wanted to be able to automate these processes so we could scale them up to other countries. And we ended up getting support from a company called Alteryx that provides like these automated ETL solutions. So I don't think, those are not names that you might traditionally associate with things like healthcare data, and yet they all made the project be able to just scale and grow and be that much more effective. So there's just a place for everyone to come and help, I think.
And ultimately, and this is one of your points, Martin, which I think is maybe a common theme we've heard today, ultimately getting down to the level of the patient, of the end user, of the consumer, and saying, how does this affect that person's life, and how do we put tools in their hands? Right. And that is a very Silicon Valley way of thinking that can actually be transformative in an industry that is often very top-down or very bureaucratic, to say, hey, this is data. If we get it to people themselves, they might be able to really change their own behavior and change their own lives. So I know there's many organizations here who are working at that customer level, at that patient level, and maybe there are opportunities to connect to an initiative like this because of that.
Yeah, definitely.
Well, please join me in thanking Martin, Anya, and Lauren, and congratulating them on this exciting announcement. Thank you.
Thank you, Raj.
And please welcome back to the stage, Catherine Cheney.
Thanks, everyone. Thanks, Raj. Hey, everyone. So in just a moment, I'm going to call up our next set of speakers, and we're going to be talking about emerging tech. So these terms that have come up all day today around pilotitis and the challenges of pilots not going to scale. There is so much potential when it comes to what emerging tech, things like blockchain and artificial intelligence and machine learning can bring to global health, but far too many examples of projects remaining in the pilot stage. Each of our speakers who are about to join us are the counterexample. They are examples of taking pilots to scale, and as you'll hear from each of them, it's really because of partnership. So these questions will be geared toward partnership. I'd love to welcome to the stage first Peter Small. I'm going to take a step over here. So Peter recently joined Global Good at Intellectual Ventures, which is a Bill Gates-funded invention lab in Seattle, but Global Good is specifically focused on using tech for good, including in the global health space, and we'll be hearing from him about that work. Nithya Ramanathan, who is the CEO and co-founder of Nextleaf Analytics, doing fascinating work leveraging data and the Internet of Things to track, among other things, vaccine cold chain storage, so we'll learn more about that. And next is Joe DeRissi, who is the co-president of the Chan Zuckerberg BioHub, all about partnership. In fact, it's pretty unprecedented what they're doing, bringing together 3 major universities in the Bay Area to partner on global health technology and disease eradication. We'll learn more about that, but also about some of the work in the field that he's doing. And last but not least, Suleiman Sawadogo, who is the general manager for global health at Parcel. And earlier we heard about supply chain work. Parcel brands itself as the future of supply chain logistics, so we'll hear about that in a moment. So I want to dive right in, and I'm going to copy something my colleague Michael did earlier, because especially it's the afternoon and maybe people are tired from after lunch, we're going to start rapid fire. And the question I want to hear from each of you is, in this space of emerging technology and global health, there's a lot of hype. And I want to hear, what do you think is overhyped and what do you think is undervalued? And I'll note, it doesn't have to be technology, right? We're talking about emerging technology, yes, but also about partnerships. So maybe your answer has something to do with partnership. But I'll start with Peter. We'll go quickly down the line. Emerging tech and global health, what is overhyped? What is undervalued?
Okay, so if we're honest with ourselves, we live in an exponential era, but if you're working in global health, it's linear at best. So I think what's underhyped is lean adaptive approaches.
Lean adaptive approaches, I like it. And quick note on how do you then bring that to bear at Global Good?
Well, I think increasingly our focus is on rapid prototyping and then iteration in the fields, as opposed to coming up with the perfect 5-year consultant-driven linear inevitability.
Sounds like Nithya agrees. I love it. All right, Nithya, what about you? What's overhyped, what's undervalued in this space?
I'll focus on the undervalued. I think, a lot of us talk about partnership with ministries of health and government, but I think what's really undervalued is how do we really dig in and understand what is the strategy of the government? How do we first start with the problem? Like we talk about user-centered design, product development, rather than coming in with the hammer and saying, I've got a hammer, how do I really sit down and look at, okay, what are the resources the government has? What is the problem? And how do we solve that problem for the government? And we look at ministries as customers and design products for them.
Great, thank you. We'll hopefully return to some of that. Joe, would love your take on this.
Yeah, well, I'm an infectious disease guy, and so I look at things through that lens. And for me, in these last few weeks, it's all about coronavirus. I think what's undervalued from the countries and the teams that we work with are the local expertise on the ground that is connected with the patients actually coming in the door, and point of care, unbiased, sort of hypothesis-free diagnostics where you're not just looking for one thing, but you're seeing the whole picture and connecting that with data. Those 3 things aren't really connected well, and if you could, I think those things are undervalued.
I'm glad you brought up coronavirus, and I know there was a breakfast gathering with some members of the Bay Area Global Health Alliance talking about that very topic, so we will return to that. Thank you. And finally, Suleiman, I'd love to hear what's overhyped, what's undervalued. It doesn't have to be a technology per se.
Yeah, I guess I'm going to go with the overvalued. I think that thinking that we can sit here in San Francisco or in Geneva or Washington, design a solution that will work and solve the world problem, to my perspective, is overvalued. I think that we have to really engage in learning about the problems that we're solving, engaging with the beneficiary and the community that we aim to solve their problems. So I think that this is overvalued to my perspective.
And I know you're currently based in Denver, that's where Parcel is based, but you formerly worked with the CDC across many countries in Africa, so you can definitely speak to that experience. Yep. I want to ask a few questions of each of you now, and I want to start with Peter. So Devex has written before about global good at Intellectual Ventures. You're doing some really exciting work in the global health space, but you've basically spent the past 4 months leading a team that is surveying the major global causes of morbidity and mortality and looking for opportunities for technological solutions. So speaking of, emerging tech and what potential can it offer and what are the limits, that's been your job, figuring that out for the past 4 months. So I'll just ask, what have you found?
Yeah, so our focus is on primary healthcare, and I think that primary healthcare in the future in low and middle income countries will be increasingly patient-centric. It will be more proactive and it'll be more connected. And in that context, I'm super excited about connected diagnostics. And it's not a new concept, but it's one that I think is very ripe. And that is the ability to bring a point-of-care test, a cell phone, and some AI together to enable there to be, I would say, expert quality clinical decision-making in every patient's pocket.
Great. And in terms of what might be next, right? So for the past 4 months, you've been kind of exploring some opportunities. You probably can't share too much in terms of where you're going to invest your time and energy and resources, but what might we keep an eye on?
Well, one thing I'm super excited about is a point-of-care tuberculosis diagnostic, a urine test for LAM, which will almost certainly fall short of the sensitivity and specificity that's required. But if you add to that a cell phone reader, which takes out some of the variability, but more importantly brings in external information like the local epidemiology based on the GPS locations, and then even bringing in a phone app that allows you to diagnose a disease based on the sound of a cough, right? And that's never going to meet the diagnostic performance criteria either. But you put all of that together on a cell phone, suddenly you dip a piece of paper in a urine, you have someone cough, and boom, you've got the diagnosis of tuberculosis. I think that's an achievable vision.
I'd love to follow that one. We'll be in touch about that, I'm sure. So Nithya, I mentioned earlier that I know NextLeaf Analytics works across a number of domains. Global health is one of them. And one of the things you're doing is you're tracking data on vaccine cold chain systems. So maybe talk about some of your most exciting global health work. And since this is all about partnerships, what is the role that tech plays? You know, certainly your platform is all about data and insights from that data. But perhaps even more critically, what is the role that partnerships have played?
Yeah, sure. For us, partnerships are key to scale. So I'll give you a little background on vaccines. They have to be kept cold, not too hot. And it's a really complex set of partners that come together to ensure that a potent vaccine actually reaches a child's arm. So you need private sector, fridge manufacturers, temperature monitoring device manufacturers, third-party logistics providers. You need the Ministry of Health, the Ministry of Finance. You need healthcare workers. You need fridge technicians. So there's just a complex set of partners. And our approach when we enter a sector is very holistic. So we're always looking at what is the entire picture and how are we going to solve this problem? And so partnerships are key. We work with all of those players. And so when we started, we were working with Medic Mobile actually in Kenya and started in 10 clinics. And the government of Kenya and the Gates Foundation took a really big risk. And so that was the very first thing we learned about partnerships. How do you really kind of transparently communicate around risk? How do you align incentives? And now that our devices are in over 15,000 clinics across 23 countries, we've learned even more how critical partnerships are, primarily first with the government. We've learned a lot about how you really learn about what are the needs of the government, how do we ensure that the data that we're collecting is actually serving the needs of the government so that the solution will sustain. But also, how do we start developing partnerships with the World Health Organization? How do we help them inform their standards so that not only our solution is scaling, but that we have an open ecosystem where any solution can thrive? Because ultimately, none of us is going to solve this problem alone. And so that's been really critical. And even looking to our partnership with Gavi again, all about how do you kind of align the incentives. Most recently with Google AI, that's been a really exciting partnership where now we can build on this really strong foundation of data, of networked refrigerators and clinics, and really start to explore how more sophisticated statistical analysis can actually amplify the power of this data.
Can you actually expand on that? Because I know the Google AI Impact Challenge grant, they just had a summit pretty recently here in the Bay Area. And I think there were so many interesting examples of what emerging tech really looks like in the field, if you will. So can you tell us a little bit more about specifically how AI and Google's not only financial support, but also technical support around AI, what does that mean for you in terms of impact?
Yeah, absolutely. So really what we're looking at is as you bring more data together, first of all, ensuring that countries are getting real value out of this data. So what we're focusing on is how do you kind of leverage the pattern matching and other kind of machine learning techniques in order to figure out where are we losing real vaccine potency across an entire system. There's so many factors that go into the loss of vaccine potency, but once you can do that, and once you can really quantify, here's the value of vaccines that are at risk potentially, you can actually now take that and not just look at kind of day-to-day management, but countries can actually use that to hold private sector accountable, to say, well, I'm risking $100,000 of vaccine, your service is costing me twice that, you know, we need to change the economics of this situation. So it's honestly less about whether it's machine learning or not, and much more about once you've created these types of computational metrics, however, how do you put those tools in the government's hands, but also make sure that the government has ownership over their data, has very transparent algorithms so that they're not just trusting a black box. So there's lots of really kind of exciting things to get into there.
I love that last point. I mean, it kind of gets back to what we were saying in the beginning. It's, yes, tech is critical, and obviously all of you are doing tech-enabled work, but it goes nowhere without the partnerships that you were just outlining. So speaking of partnerships, Joe, I want to return to coronavirus. So when I think about the Chan Zuckerberg BioHub, you know, when we talk about the lab to the field, I think about the lab, to be perfectly honest. I know a lot of your work and a lot of your day-to-day is spent in the lab together with other researchers. So tell us more about what the lab to the field, a term we often throw around, actually looks like, and about some of your recent coronavirus work.
Sure, yes. As you know, the Chan Zuckerberg BioHub is a partnership between UC Berkeley, Stanford, and UCS South, but as you mentioned, it's a little less known that we have this a lot of international partnerships and that we're trying to do this lab to the field exercise. And more specifically, you know, we have spent a lot of time developing different kinds of unbiased molecular diagnostics with an eye towards also cheap point-of-care devices as well that are all data connected. But a lot of this technology does depend on certain kinds of compute and storage infrastructure that isn't necessarily localized in all these different places. So while the price of sequencing, something that we rely on very heavily, has dropped 500,000-fold in the last 15 years, 500,000-fold, that's a big number.
Wow, yeah.
I mean, it's getting really cheap. Everyone can do the sequencing, but not everybody can do the compute and the storage. Neither the data science expertise nor the infrastructure is there. And so we saw that gap and felt that we could fill it. And our reach out there is to produce both the compute and the storage infrastructure that could be used in the cloud and the training of local specialties, you know, in the practicing of this kind of bioscience, this kind of molecular biology, to then deploy them back into the field in their own clinics, leveraging their own local microbiology expertise. So you have people, for example, in Dhaka who are in the clinic and say, you know, that looks unusual. We need to understand what's going on in this child.
Yeah.
And they can sequence it. They're not going to send the sample out to France or the US or anything. They do it themselves. But now the data and compute is taken care of. And that's the part that we've really focused on, in addition with the hardcore training, that they have to come, they have to train, and then we go back and follow them into the field and train there as well. And so in partnership with the Bill and Melinda Gates Foundation and their Grand Challenges Explorations Program, we're now spinning up 11 different sites this year. So Bangladesh, Vietnam, Nepal, Pakistan. I just got back from Cambodia like 3 or 4 weeks ago and so on. And so Cambodia, that's a great case example in which they're really focused on vector transmission of disease. Dengue, of course, is a big deal there. And what they didn't realize is that their entire attention would be turned to Wuhan coronavirus in a moment's notice. And with one index case in the country, also working with Institut Pasteur there, all of their resources are now being devoted to quickly scale and be able to produce tests that can be done, for example, when a cruise ship docks and disembarks a bunch of people. But those countries are all on the perimeter of China, and they are under-resourced to be able to screen and surveil for a major outbreak such as the one we're experiencing now. And that kind of monitoring and surveillance is what's going to be essential if we have any hope of containing this ever-growing pandemic.
I actually was not aware of the partnership with Gates, so that's really interesting and something I want to follow. So we'll return to that if we can before we move to Q&A, but I want to bring Suleiman into this. So again, I mentioned earlier, Parcel talks about the future of supply chain logistics. And speaking of emerging tech, big data analytics is part of how you're doing that. So can you talk about what exactly that looks like? How do big data analytics play into your model? But what role do partnerships play?
Yeah, great question. I think as Parcel, from the beginning, we wanted to solve like one of the major challenges. And we decided from the beginning to trying to solve the problem, bringing end-to-end visibility to the supply chain in sensitive goods, especially in the hard-to-reach population, the last mile. And our focus has been really working with Gavi and monitoring vaccines supply chain. Currently, we are working in Senegal, and what we're trying to do, we're not inventing data loggers. What we're trying to do is to re-engineer the tools that we're having to meet the needs in area of no connectivity and very challenging. Because think about it, the majority of vaccines being used is, in fact, kept at the last mile, where there have been challenges in accessing the condition of the vaccine, the quality assurance, making sure that the vaccines have been kept at the right temperature. And even if they're able to do that, they missed the piece of monitoring the temperature during the transit. So what we're trying to do is really bring end-to-end visibility in the vaccine supply chain during transit and storage, and especially with, again, an emphasis at the last mile. We are not only trying to do that, but we wanted also to improve the experiences of the healthcare workers, giving them the tools to not only ascertain that the vaccine they're inoculating to the baby is potent, but giving them some tools to actually prevent vaccine from going to waste by mitigating the risk. Because, in fact, if you go to many of these countries, they have like some guidelines, WHO guidelines that are in PDF form, but being able to digitize it and embed it to our mobile app and giving them instruction to do it actually is not only protecting the investment that we're making into the vaccine, but it's empowering the end user. And I think that we are bringing this paradigm shift to focus more on the end user and the beneficiary, because most of the time we design solutions thinking that's going to work without really taking into account the perspective of end user. We have been able also to work with them. It hasn't been easy, changing. We have to be really, I think that one of the reasons that we think that we have been able to scale in Senegal is really using the perspective of the end users. Yeah. They have a set of problems that may seem very difficult to solve, but coming and talking together, we could easily embed this solution into our solution to them. And not only we are allowing them really to feel empowered, but actually they are going to the extra mile and making things possible. For example, we have been able to challenge certain assumptions because our solution works with a mobile phone, an application on a mobile app, web app, and either a gateway. And initially, when we were going to Senegal, we have been told that people don't have Android phones because our solution requires an Android phone. I would like to invite people to challenge our assumptions. We realize currently, as I speak, we have our solution deployed at over 1,000 sites in Senegal. We haven't, guess how many cell phones we gave them? 0. we haven't given them any cell phone. We are partnering with them, they're using their own mobile phone because they see the value into using our solution. In addition to that, in some few facilities where they didn't have a compatible phone, they managed to buy Android compatible phone for the healthcare workers. Also tell you that when you have a solution, well-designed solution, agile solution that can really take into account the user and the consumer perspective, they are willing to run with it. As I speak, when we deploy our solution, we don't need to go there because it has been integrated in the ministry training schedules. They do everything. What we have to do is ship our devices to them, and they will do everything. Actually, I was talking to some of our engineers last time. People in the field in Senegal, they know our solution, they know how to use it better than some of the people that design and develop the solution here.
I want to end rapid fire as we began rapid fire, and then we're going to bring in some questions. And I really want to make sure we carve out time for questions. So we all see this monitor here. You have 1 minute. The question is, I really want to make sure we're delivering on the promise of this panel, which is from pilot to scale, how emerging tech can make a real impact on health. So we've heard kind of a preview from some anecdotes of what each of you are working on. We've heard your thoughts on what's overhyped, what's undervalued. I want to get to that how. What is missing? Pick a single technology if you'd like, or just talk about the space more broadly. What is missing when it comes to how emerging tech can actually get from pilot to scale? A minute each, any thoughts you have, and then we'll take a question from the audience.
Well, I think we have to look at the technology that's in their life presently, and it's a mobile phone. And then you say, what can you do with that? And that scales very rapidly. I'm a huge fan of acoustic AI. I think that there's a lot of information in the airwaves that can be filtered and used for public health good.
I'll quickly say I was just speaking with someone involved in the Google AI Impact Challenge working on acoustic AI, so I'm very interested to follow that space. Nithya.
And I think actually our acoustic monitoring platform was the basis of one of those. So I'm a big fan of that as well. So I think for us, we see healthcare workers and ministries of health as actually the next technology workers. And so I think the biggest how and the biggest opportunity that we see is really ensuring that ministries of health, ministries of finance, healthcare workers are equipped with tools to actually use data, really understand that data, and act on that data.
Great.
I would echo exactly the same thing, is leveraging that local expertise, and they become the expert user, not us. And how do we, and what are the tools that they need, and learning from them what is required to solve their local problems, not what we think they need solved.
And in terms of how we do that, it goes down to the way we design our programs?
Yes, and you have to be there.
And you have to be
You have to
there,
have boots on the ground.
And flows of money. I mean, we've got to incentivize this type of knowledge transfer, and
Yeah.
because countries know what they need, but they often just, the resources aren't matched up. So.
Agreed. Great. Suleiman, how do we get from pilot to scale? Any additional
I
insights?
think that we have to be patient, and we shouldn't be afraid of failing. Actually, you have to look at it another way. When you trip and you fail, it's an opportunity for improvement. I think that this is it. And funders and donors really to be patient and really take the risk with startups. You know, there are great technology there. I think that at this point in time, I think that the technology that we're having can really save the world or make a difference. But we have to find the right ecosystem, the right partnership. We can't do it alone. Yeah, I think that partnership and working with locals and understanding the context really will help us to get to scale. And not only getting us to scale, will be adopted and sustainable. Because sometimes we forget about sustainability. We can have a solution, a great solution, we push because of our resources, people will accept it, push it, scale it up, but at the end of the day, it's not impactful. And health solutions takes time, the impact takes time. It's a really long-term impact.
Great, I agree. Let's bring in some audience voices here. And I know we have a question. Earlier you heard Ben Plumley mention tech for HIV. And I believe Marguerite Hanley is somewhere nearby. I was hoping to take a question from her. Hey there. So we spoke ahead of this event, and part of why I wanted to get your reaction to the panel or a question from you is, speaking of partnerships, when we look ahead, AIDS 2020 is coming to the Bay Area. And I think HIV/AIDS is a great example of, you know, tech plays a role, but partnerships critically also play a role. And here in the Bay Area, we really have a tale of two cities when it comes to HIV, looking at Oakland versus San Francisco. So tell us a little bit about your work, if you will, at Tech for HIV, and then if you could pose a question to the panelists, would love that.
Absolutely, thank you. So Tech for HIV is the alliance between tech companies and public health institutions working to really scale existing and emerging technologies to impact the HIV response. We've heard a lot today about data, and especially about really exciting emerging technologies like AI, machine learning, predictive analytics. But what we tend to ignore in all of this excitement is that there is a universe of existing off-the-shelf technologies that can make a massive impact in public health. And public health, as we know, is lagging a bit behind the private sector. We're still really very much in the 20th century, and we should be diving headlong into the 21st century because the HIV pandemic is not shrinking, it's growing. Contrary to mainstream popular belief, the pandemic is not slowing down. We do have more people living longer, healthier lives on antiretroviral treatment, but that actually means that the cost of the pandemic is shooting way up at a time when funding is flatlining and even really going down. So we have more people becoming newly infected, costs are rising. How can we affect that? Through technologies. And we're really focused on existing technologies that the private sector has been using for decades and public health has failed to implement in a really standardized, scalable way. And so that's what we're looking at leading up to AIDS 2020. How do we marry tech companies and public health institutions in a meaningful way? And historically, tech companies have supported HIV and public health really through in-kind donations. And so to bring this back a bit to the partnerships question, how can tech companies go beyond the philanthropic model and really create meaningful, mutually beneficial partnerships with HIV and public health institutions in general to impact the HIV response and try to get to zero new infections?
Great question, thank you. So how can tech go beyond the philanthropic model? And I assume each of you has probably had experience both engaging with tech very much in that traditional philanthropic model sense, but also engaging with tech companies perhaps in a more sustainable, true partnership. This is for the long-term way. So any reactions to that question? Nithya?
I can jump in there.
Great.
I think one of the partnerships that was really successful around creating shared value was a partnership we had with Intel, where a specific group at Intel was actually looking to get into the IoT space. And we had a really compelling use case. And so there was very much a shared value where they actually designed the first, second device that we deployed around the vaccine cold chain, and then that allowed them to actually take that platform and explore it for business use cases around distribution of beer or something. But it was really fantastic shared value, and one that actually we continue to replicate in a number of different scenarios.
Great example. Did anyone else want to jump in? Joe?
From a collaboration standpoint, with specific reference to HIV, you know, the BioHub is about basic science. And our partnership, for example, we have a great new partnership with Zuckerberg General Hospital, and our goal there is cure, not prevent new infections, let's cure. And understanding the niche which latent HIV really resides in, and understanding how that niche and how that latent reservoir operates, and how to get at it, and how to kill it. So that's all I care about.
Yeah, from my perspective, I think that, yes, good point. Having spent 15 years of my time working on HIV, I have to let the audience know that actually resources that developing countries have been putting toward they're owning their response now. More and more, they have been pushed to be putting more resources toward the HIV epidemics. And I think that philanthropy is good. You know, charity money is good as an enabler and a conduit. I think that people have to own their response. And I don't think that people are not willing to really own their response. We have to really work with them and really transition have a pathway of transitioning to countries and individual ownership. In any place in Africa that you go, people are paying to access private healthcare because they have a trust into it. So I think that building this trust, there is opportunity for people really to own I think that people owning it, people are willing to pay for it, and that's more sustainable rather than relying on handouts from charity and philanthropists that will never be there forever.
Thank you for the question. And I see we have a question from the audience, although I'll invite a question because we haven't had enough space for that today, and then we can have just one panelist answer it very quickly.
I really appreciate that. My name is Sophie Bergqvist. I've been working a lot with purchasers of care in middle-income countries, and I see that growing quite a lot in many countries. More and more countries are moving to national purchasers and so forth. Some of them are stepping forward, asking what can we do with the innovative space of innovation in healthcare. So for small companies and for the work that you do, what can they do? So if they set up an innovation unit with the aim to support new innovation, and to be more specific, the trade-off between co-creation and partnerships, but also fair competition. Do you have any comments on that? If they are going to design a program for innovation, what should they do?
Who wants to jump in? Peter, did you want to, since you didn't get the chance to chat in the last round?
Yeah, I think, you know, look, one of the reasons we're where we are in this linear field is because we've been obsessively focused on the public sector and supply side. I think what you're talking about is a huge opportunity to reverse that. And exactly what can be done is, I think, real genuine partnership, a willingness you know, to work shoulder to shoulder, to take a prototype, to try it out, to give the feedback, and then to try it again and again and again till it's right.
Great answer, and we get nods of agreement. So thank you, Peter, for representing our views on that. And thank you for the great question. Well, I really love some of the points that came up, and especially the question that came from Marguerite around, yes, we're talking emerging tech, but whether we're talking established technologies we can take off the shelf or emerging tech, really it's not about the technology per se, it's about the partnerships around it. So thank you to our panelists who are all doing really amazing tech-powered work, but also really emphasize the role that partnerships play today. Really appreciate your time. Thank you. And with that, speaking of partnering with tech companies, I'm welcoming Raj back onto the stage, and you've been hearing a little bit of a preview all day that we're going to hear from Facebook and some of their work on global health, and Raj will be introducing that session.
How about another hand for Catherine in that panel? That was fantastic. I don't know about you, I was Googling acoustic AI to figure out what that was. This is pretty remarkable group. I cannot believe we're actually at the end of the day. This is the last session, and it's an exciting one. I want to ask our next two speakers to come join me on stage. KX Jin, the head of health at Facebook, and Amy Batson, the executive director of Women Lift Health at Stanford University. Come on up and join me here.
Thanks.
Thank you. Thank you. So there's a famous Mark Twain quote, which is something like predictions are hard, especially about the future. But it's hard to have like a tech and innovation conference where we don't think about the future. So we're going to get there in this event. But first, it is kind of a rare opportunity to have KX on stage. So I want to take a moment to hear a bit about what Facebook is doing in the health sector. For those who don't know, KX met Mark Zuckerberg, I think on your first day of classes at Harvard, if I have that right. And you actually graduated, unlike Mr. Zuckerberg, which hopefully you needle him with once in a while. You were one of the early employees, and you were involved in some of the core elements of Facebook that we all know, newsfeed, advertising, groups. And you recently, as I understand it, chose to take on this role of leading health. So a pretty big thing for our community. I'd love to know, what does that mean? What is Facebook doing in health? What's your vision for it?
Great, thank you, and thank you for having me. Really excited to be here. So it really starts with the Facebook mission, which is to give people the power to build community and bring the world closer together. And I probably don't need to tell other people in this room this, but people have really always relied on others and their community for support around health, whether that's caregivers, family, health workers, and so on. And with the rise of the internet and phones, more and more of this is happening online. And so I think for me personally, I just felt there was a real opportunity and actually just a responsibility to better support some of those needs. And that's what my current team, which is part of our broader social impact efforts, is focused on. So finding ways to help bring people and organizations together to improve health and well-being.
And maybe you can give us an example. I know it's early, but a sense of where this can actually have an impact.
Yeah, I'm gonna give you a couple. So probably our most mature product is our blood donations tool. And this really came out of a need that we were seeing happen on our platform. So people were actually asking their friends and family for blood donations, and this is happening quite a bit, especially in markets where the blood supply is more on the replacement model, where the burden's actually on the individual to find donors. And at the same time, we were also seeing blood organizations using our tools like groups to organize donation drives and camps. And we thought we could work together with these people and organizations to better support those needs, and we ended up building a tool around blood donations, and it's actually pretty simple. So on one side, people can opt in to be registered as blood donors on Facebook, which just means that you only get notified when there's a need locally. And then we also work really closely with blood organizations so that when there is a need nearby, we can notify the donors. And this product's been around for about 2.5 years now. Excited to say that at this point, over 60 million people worldwide have signed up to be donors, including over 40 million people in India alone, which is one of the first markets we launched the product to. And probably more excitingly, it's not just the numbers of people who have signed up to be donors, but we're seeing increasing evidence that this product is actually driving incremental and significant new donors to blood banks and really helping, and that's coming from the partners themselves.
Do you have a sense yet of the 60 million, how many have been able to actually donate at this point?
I think not specific numbers, but certainly from a blood bank perspective, we have many case studies where individual blood banks are able to like survey people and attribute people on the way in, and a very substantial percentage of those are coming from Facebook in some of these
Gives
cases.
you a sense of the scale of the platform.
Yeah, so that's one example. And then a more recent example is a lot of our work around coronavirus, COVID-19. And here I think there's a clear need for people, ultimately people want information and accurate information about what's going on. And so we're working really closely with organizations like the WHO, as well as a variety of local ministries of health to help them meet people where they are and searching. And so when people search for, say, coronavirus or related terms, we will show credible information at the top of those results and link to the WHO website, or to relevant other websites, as an example.
Yeah, getting that credible health information out is really key. So many more things I want to ask you, but I want to get Amy into the conversation. Amy, at the same time KX has been at Facebook, you've been spending a lot of your career on the other side of the fence, in a sense. You were at some of the major global development organizations, including in a leading health role at USAID. You were chief strategy officer at PATH, the major NGO working in the health sector. So, as you look at some of what Facebook can bring, a platform of this scale, we're getting a sense of it, what do you see as the opportunity, and kind of put your hat on from the public sector side? What do you think the public sector ought to know, or how should they try to engage with the major tech companies of the world like a Facebook?
Yeah, it's incredible to hear about an example of, in just 2 years, getting 60 million people. I mean, it just doesn't happen in our public health world. I think Peter was sort of saying we're very linear, and unfortunately, I think that's been the case. So I think there's some amazing opportunities for our community to learn from and build on some of these platforms that are reaching individuals where they are and can provide them with the best information, accurate information to inform their health-seeking behavior as well as their kind of individual behavior change. And so focusing on that demand side, which we've been so weak on, frankly, in the health sector. I think also on the supply side, I mean, the value of data, of being able to know where people are, know what's happening, be able to have all of this data kind of brought together and data sets combined to be informing decisions of where your health workers need to be, where your equipment, your medicines, your vaccines, has such opportunity for improving the efficiency and the quality of our health systems that it really is sort of a chance for a game changer, taking us out of the kind of vertical, siloed approaches that we've been fragmented into, and starting to get into some space where we can really be reaching people where they are and making sure that the supply side of what we have is meeting the demand side of where people are and having a better health intervention.
So much of what we've been talking about today are partnerships. So with your hat on now, KX, leading this initiative of health, how is Facebook planning to engage and interface with the USAIDs, the PATHs, the many other organizations that are here today, some of which may not understand, might be skeptical, there might be trust questions. How do you say, look, we've got this 2 billion person platform, here is how we can actually partner together?
Yeah, I think it's really important we work together, and it's partly why we're here today, right? I'd say what we're trying to do in our team as part of our broader social impact efforts, which have been around at the company for I think 4 or 5 years now, we're actually gold fundamentally on the long-term social impact we can deliver. And I think there's a belief that if we do this well, this will be good for usage, because if we're building services that are useful for people, they'll
keep coming back, you'll get more users.
And it'll probably be good for our brand, but actually the goal of the social impact team is purely on social impact. So the work on our blood donations team is actually gold on, are we actually helping the blood banks build toward a sustainable supply of safe blood? And we're trying to actually measure and work with them to measure the incrementality we're delivering. In terms of how we pick what we do, this is something we're thinking a lot about. At a high level, we want to find things that Facebook is uniquely suited to do and where we can have a significant contribution. So unique in the sense of if we didn't do it, it wouldn't happen, or someone else can't do it better, right? And if someone else can do it better, they should do it. So that's what I mean by unique. Significant is in the context of the actual health issue we're working on, the contribution needs to be meaningful. It can't be 0.5%, right? And so we're trying to find things that hit both of those criteria, which generally mean they're very mission aligned to Facebook, right? When we're fundamentally about connecting people, building relationships, and so on. Where we really do need to learn is get input and around well, what are the health priorities, right? That's fundamentally not our area of expertise. That's actually the public sector's area of expertise. And so I think the real potential for collaboration here is taking that input and then working collaboratively together to figure out where are our unique strengths, and for which of these issues can we work together to have a significant positive impact in the long run.
And so Amy, again, thinking back to your background here, what do you see as the opportunity? If you were talking to USAID,
what should they be doing
Yeah.
with Facebook? How should they access this chance to leverage the platform?
Well, I think what the maxim KS said of, like, if someone can do it better, let them do it, is something we in the public health sector should take to heart, because we're often trying to do things that others are better suited to do. And so I think recognizing that some of these innovators and these firms that are investing billions with hundreds of thousands of top tech experts, we should be building on that, not trying to replace it, duplicate it, put our resources trying to do the same thing. So for us, I think the public sector has a real responsibility to be creating the space for them to be working, creating what are those priorities? Let's align the key partners around those. Let's create the guardrails that are critical to ensure that it is a quality, safe health intervention with the necessary privacy protection, with the right information in place. And a really important part of that is around the alignment of us, right? There's, that saying of we've met the enemy and it is us. I think sometimes with the number of public sector partners working in fragmented ways, we really create a lot of transaction cost and a lot of confusion, so that when private sector partners look at what should they do, it's like, well, should I be listening to the malaria team over here or the HIV team there, or what the country is saying here, but no, a donor is financing it, not the country, so should I listen to the country or the donor? And it becomes very difficult to identify really what are the top priorities. So I think the value for the public sector partners, the funders, the governments, and then their NGO technical partners and the WHOs of the world to come together to define what are some of those top priorities? What are some of the required standards that we want to put out there to ensure kind of safety? That we can then help really leverage up some of these technologies and make sure that we're serving the people of the world.
Does that resonate with you, Kex? What do you see as the big barriers to having the impact that you want to have as an organization?
So certainly, I think getting the input on what the global priorities are is incredibly helpful. I will say, with the partners and people we've worked with so far, I've actually found that to be pretty clarifying, and not having experienced a lot of that, but that is extremely important. I do think one of the challenges we see is take misinformation, which is something we've spent a lot of time, and I've spent a lot of time thinking and working on in the last year, is misinformation really thrives when there's a void or absence of accurate information or trusted information. And fundamentally, every parent, I'm a parent, I have 2 kids, they want what's best for their kids, right? And they're seeking out that information online, offline, and so on. And I think there's a lot of, we clearly need to do, and we have work to do on removing and reducing harmful information, but just as importantly, we need to help get people access to credible information and from trusted sources, right, in the moments that they're seeking it out. And that's something that I think we really need to do in close partnership with the public sector, because again, we're not the people who have that information. That actually really shouldn't be us, but we need to work closely to connect people in that way. And so I think that's a really, really top of mind thing for me.
Just not to interrupt, but I've got a little story in my book about something called condom water. I don't know if you've heard this before, but apparently in Colombia, this is going back several years, a rumor spread on Facebook among high school students that if you boiled condoms, prophylactics, in water and drank it like a tea, this would prevent pregnancy. And a local NGO that works using algorithms and machine learning on the Facebook platform in Colombia, they were able to find this and then get out there with credible information to try to counteract it before you had a really significant problem. Apparently it did. This is what the NGO claims, that it did work. But as you say, there's 2 sides of this coin. There's a misinformation problem, and then there's getting the accurate information out there.
Yeah, there's a couple other examples in the vaccine space that I found pretty interesting out of, I think, Denmark and Ireland, where both countries had pretty severe declines in HPV vaccination rates over a period of 4 or 5 years. But then over the last few years, they've actually started to recover, in some cases pretty dramatically. And so it's what happened, right? And I think a lot of it was actually a cross-sector coming together, parents, health workers, government, and really like creating an advocacy campaign to tell the story of like why this vaccine is effective and safe, and like meeting parents across media. That's both online and offline, and it was very effective. And I think that's an example of like something that we can learn from and hopefully apply to other areas.
And vaccine hesitancy is a big one, certainly in this community, a real challenge that we've got to take seriously.
Yeah, and the WHO has been very clear about that as one of 10 threats they identified in 2019. Right?
So I cut you off before, but I want to move to the next thing, unless you've got a final point you want to make. With the limited time left, I do want to start thinking about the future a little bit. And you both have interesting vantage points from which to think about that future. So, a lot of what we think about when we think of the future today is pretty negative. I mean, there's a lot of threats and challenges out there. Vaccine hesitancy is one, climate we just talked about earlier. What do you see as the potential, stitching together the many people that are in this room, the many elements of the global health community, which has now grown and expanded to include private equity investors and technology companies? What does that future look like if you had your ability to see that vision come to fruition? What do you think, KX?
Me first?
Yeah, sure.
Is it like, what, 10-year horizon?
Yeah, think about 10 years from now. Where could we go? What's possible?
Yeah. This is hard to predict. I was actually thinking a little about this, just like, think about 10 years back, right? It's like 2009, 2010. I mean, I think the most crazy part is like 2010, 2009, most people in this room wouldn't even have a smartphone, right? And so it's actually kind of crazy how quickly technology changes. So I'll try to answer this in two parts. One is like maybe a little bit specific to health, and another is more about technology. So I think on health, one of the things I'm very excited about is working together to fully unlock the value of this current tech platform, which is really mobile phones, for good, right? And I think to do that, and you've probably heard a lot of this today, we're going to actually have to work together online and offline to build trust and relationships across all of the people that care about this, from people, caregivers, health workers, the public sector. And I think we actually all have a lot of the same goals. So I think it's possible. And I think one of the powers of technology is this type of ability to make it easier to connect. And I think we should work together on how to bend that toward the arc for good. And I think that applies to a broad set of issues, right? Like we have this like horizontal vertical thing, right? This is kind of a horizontal thing, but it's important for blood donations, where fundamentally you're connecting people and organizations in the blood banks, right? Blood donations also, I think, really just shows the tremendous capacity that people have for good and generosity, right? Donating blood is fundamentally an altruistic thing, and it's pretty amazing that this many people are willing to do it when presented with the right opportunity and the right information. So, but it also applies for vaccines or a whole other thing. So I think that's kind of like the first thing that I'd love to realize over the next 10 years. We're able to realize this at scale, and with the associated causal impact measurement, so we can really understand what's working and what's not. On tech platforms themselves, I mean, this is really hard to predict. If you'd asked me 10 years ago, like I probably would not have actually predicted the explosion in mobile phones, and I'd say like that's a big part of the reason why 2012, 2013 were incredibly difficult times for anyone working at Facebook, because we were actually just so late to the shift to mobile. A couple trends I am excited about. The first is VR, so not AR, but VR. For those of you who haven't tried out the Quest, I'd really encourage you to try it, not because it's an Oculus product, but it's something that I think is like starting to capture the potential of VR, and there's a lot of like gaming going on, but I think just like this potential to really help connect people, have that feeling of presence, is going to actually be much broader than just gaming.
And people are going to live in a more virtual reality world.
So I think, I mean, like, we have vastly distributed teams. A lot of like communication and coordination is now distributed. You have, VC, right, which is a big step up from a phone call. I do think there's a lot of applications there in the VR zone where that can actually make the communication even more real. A lot of applications in health too. So that's one kind of new platform that's emerging that I actually expect will land before AR, or if you're talking about like, glasses for AR and so on. And the other one's just like more AR voice assistance, kind of ear type augmentation. I think that's also going to be pretty big. But like I said, I actually think we haven't yet fully harnessed the positive potential of the current platforms, mobile phones, and that's something I'm very excited to work on.
Amy, your thoughts, again, 10-year time horizon.
Well, from the non-tech perspective, but for implications,
Yeah.
I think it means we're going to be able, health will be actually coming to the level of the individual, that people will be able to get access to good information to inform themselves. Hundreds of millions of people will now have access that don't have access right now. And I think that that's going to be a tremendous game changer of creating demand and creating smarter consumers. I think that I'm looking, in 10 years, I think countries will have built up their knowledge and expertise with then the voice to be building their own kind of digital and implementing their own digital strategies around their priorities. And that a large part of that will then start to be moving away from the very siloed one disease, one intervention at a time, which is often, frankly, more donor driven. And that gets driven by some of these platforms to be more like, how do I use this communication tool with so many people across everything I want that individual to know? How do I start using a technology that's informing my logistics across all of my different products that I'm using at any one time, not just my vaccines or just my malaria medicines? And so that we start to have those kind of cross-cutting platforms that are really driving efficiency. And I'd say the last thing is just looking at the different partners. I could see in 10 years where we built up enough experience, enough trust, enough sense of the extraordinary value that we now have kind of that alignment together, so that the investors, the country decision makers, and the innovators are all kind of sharing the same information, starting to share some of the same priorities of what is needed to serve our world, and that we start to have a more sustainable marketplace here, where we're finding ways to make sure we're driving down the costs of serving this world for the private sector, at the same time as they're helping ensure that these products are affordable through sort of innovative mechanisms like tiered pricing or the marginal pricing and whatnot, so that everyone is starting to be able to kind of go forward in a more sustainable way.
It seems to me like getting some things right now will be pretty critical to the vision that the two of you have painted, things like privacy, data ownership, things like the roles that these organizations play. You use the word alignment, you use the word trust. If those things don't happen now, you may never get 10 years from now to the vision that the two of you are painting. I wonder if either of you have a reaction to that as we close the discussion.
Yeah, no, absolutely. I think trust and relationships between us and the public sector and the people we work with, incredibly important. I'd say even just in the last year, that's gotten better, right? And it just takes time. You have to work together. You have to learn each other's language, and you have to just honestly work through some difficult issues together. And we're definitely still learning and still really early, but it's been really interesting to reflect on some of the work we did with some of the organizations I mentioned around vaccines last year, and how I think that has helped really us be more effective at working together around COVID-19 this year, and I'm really hoping to take some of those learnings and apply them going forward.
100% agreement. I think it's it's the step-by-step build. Trust doesn't come overnight. Yeah. Trust comes through experience and through people kind of saying we're going to do something and then following through, and both sides recognizing the value and both sides taking it forward. And I think that that's something we're seeing happen. We've heard a lot of examples in this room. Starting to see things like using the WHO information sources around vaccines and coronavirus and stuff. That kind of creates the trust in the public sector side that then they go the next step. And for Facebook, they start to see that, yes, we stuck by what our priorities were, we provided the content that was necessary. That creates trust on the other side. And gradually, we can continue to build on that and do more things that are more complex, that are maybe a little more risky, and kind of get out to that future that we envisioned.
Well, it sounds like 10 years from now, you might be reading Devex with your Oculus goggles on, but we will be covering this 10 years from now. Please join me in thanking KX and Amy for this great discussion.
Thank you. Thank you.
And it's hard to believe, but we have come to the end of this incredible day. For me, at least, it was pretty inspirational to get to hear from a lot of people who are up here doing real work every day on these issues at a time when, frankly, you could use a little more inspiration in our lives. I don't know if you feel the same way I do. And it was cool to walk around and listen to some of the little conversations happening, including at these tables. There were a number of partnership discussions. KX was in discussions all day, and many of you were too. I know last year when we held this event, or it was actually technically in 2018, there were so many interesting partnerships that came out. Some of the things you heard up on stage today, I think some things that were being discussed today in the room, you might be hearing up on stage here next year. So this opportunity to really bring everybody together means a lot to us at Devex. I really want to thank all of you. I want to thank the folks who are joining from all over the world online, for those who have made the trip to come here to San Francisco or are based here and joined us today. These are topics and issues that mean a lot to us at Devex. You read our journalism on these topics all the time, and it just makes a difference to get a chance to meet so many of you in person and have these discussions in person. If you're newer to the Devex world, you should know that there are 1 million other Devex members around the world. So these are development and aid worker professionals who are often in the field and sometimes at headquarters, but they're all over the world working on ag and health and economic development and every flavor of global development. And we really wouldn't exist without that incredible audience that really makes our work meaningful. If you're a Devex Pro member, I want to thank you. If you're not one, you should think about joining. That's our professional membership, our subscription to additional, deeper information that our journalists, including Michael and Catherine and others that you've seen today, are covering for professionals who work in this field. If you love Devex events, we probably do 60 to 80 of these a year. This is one of our bigger ones, but we have online events, webinars, we have newsmaker events with leaders of development agencies, members of Congress, and others. And then we do our biggest event, which is June 9th of 2020, coming up in Washington, D.C. It's Devex World. There's a little bit of information at the end of your booklets. Have a look at that. It's a really exciting agenda. I've got some information that you'll see online soon about some of the incredible speakers. I'll just preview that we have the CEO of the Gates Foundation, the new incoming CEO of the Gates Foundation, among many other exciting speakers you're going to want to hear from. Events like that and events like this don't happen without partners. So I want to thank all of the incredible partners who made this day possible. And we had upstairs Smile Train, for example. They brought their virtual reality training system for surgery. And that's not the kind of thing we would be able to have at an event like this if it were not for a partner like Smile Train. So I think there's still a few minutes to catch it if you want to before we close today. But partners like that make this event possible. So thank you to all the partners who have been working with us for so long, Marianne and MSD and so many others who make this possible. I hope to see you here at Prescription Progress 2021. We will let you know when that is happening. And I do want to thank the Devex team. They make this look easy in many ways, but there is a big team behind this, both people here in San Francisco and people all over the world, actually, pushing out articles, newsletters, social media. So thank you to the Devex team, and a special thank you to Catherine Cheney, who literally makes this event possible. Please thank me. And I'll just leave you with one last thing, which is apropos of this conversation. Bill Gates often talks about how we overestimate what you can do in 1 year, and we underestimate what you can achieve in a decade. There are a lot of challenges right now, and it may be tough to see the way forward, but it is possible, and it's possible because of so many organizations like the ones in this room. And we at Devex will continue to highlight those solutions, to focus on accountability and transparency to push this industry forward, but we think there's real potential because of the work all of you do. So thank you for being a part of this awesome day. It's really great to see all of you. Thanks.